Those popular injectable weight loss drugs are easy to use and backed by doctors and proven to help. But the popularity of the do-it-yourself injections has a serious side effect. 2 Wants to Know's Kevin Kennedy found the number of people overdosing on weight loss drugs has skyrocketed, with thousands calling poison control centers last year alone.
For more than 20 years, Leslie Gammons spent her days in a classroom. Once a teacher, always a teacher.
I said, I don't want this to happen to anybody else.
Even in retirement, her passion to inform and educate remains. Sometimes the lesson taught come from personal experience.
I would not put that on my worst enemy.
In late 2025, Leslie unknowingly became a case study for hundreds of thousands.
I blame myself for not being more educated, I think.
She began taking an injectable weight loss drug in 2025. She never met with a doctor, not even on Zoom. Almost every medical decision made and sent by email.
All I had was a phone call, but it was a recording that says, go online here, do this and this and this.
Leslie used the virtual healthcare company Amble. It connected her with a doctor who initially prescribed a low-dose weekly semaglutide. But after 2 shots, Gammon realized it wasn't working.
I woke up probably like around midnight, 1 o'clock, and I was like, dude, I want a pizza. I mean, I was hungry.
She says that's when a doctor with Amble doubled the strength of the medication and told her to fill up her syringe with 5 times more medicine.
I contacted them. She was like, just follow the doctor's orders. This is the max dose that you can take.
Skeptical.
That's what I took.
Leslie says she stopped short of taking the full amount.
Every 30 minutes, I was throwing up.
She rushed to the emergency room.
I was weak, dehydrated.
Doctors pumped her body with IVs and anti-nausea medication.
They were more worried about my kidneys and my liver.
Leslie was in a fight with her body, the weight loss medication overwhelming her system.
I do remember asking the doctor, just put me in a coma. I can't do this. It hurts.
She'd remain in the hospital for several days, a diagnosis later provided.
They said, yeah, you overdosed.
Statistics from the National Poison Data Center, America's Poison Center, show a concerning trend. Since 2019, there's been a nearly 1,500% increase in GLP-1 calls related to overdose or side effects, with almost 23,000 cases nationwide in that time.
If I'd have taken the full dose, they don't know where I would have been.
3 months later, Leslie is still recovering. Fortunate this wasn't worse.
This is the button you would push.
Wanting to better understand more about these drugs, we spoke with Dr. David Vollinger with Novant Health.
They're a great tool that needs to be used as a tool.
Dr. Vollinger fully supports the use of injectables as part of a comprehensive weight loss approach. He has seen positive results in his patients.
It's very potent,
but says the risks are real.
They sometimes work too well, and the side effects then can turn into severe complications.
The bariatric surgeon recommends people read the fine print, use FDA-approved drugs and preloaded GLP-1s.
This is what will prevent you from overdosing.
Rather than the compounded vials like Leslie used.
You're saying talk face to face.
100%.
And only use them under the close supervision of a doctor who intimately knows your health history.
This needs to be treated just like high blood pressure, diabetes, any other chronic disease, and not just over the phone with someone who doesn't have your vested interest and your medical chart in front of them.
I'm not dumb, but I felt dumb.
It's a message Leslie wishes she learned sooner. This lifelong educator is grateful she didn't take the prescribed amount, but regrets not going to a doctor's office.
My ribs, my back hurt, it like I was being punched.
Not only did that decision send her into a medical tailspin, it cost her almost $10,000 in hospital bills. She has since complained to the doctor and staff associated with Amble and Beluga Health, the medical provider group used by Amble, asking for answers and pushing them to cover her expenses, something they haven't ruled out at this point. An email sent by Beluga Health to Leslie. It states, in part, it is just very complicated with dosing GLP-1 medications, and I think there was a misunderstanding of what you had been prescribed previously. An explanation not sitting well.
Nothing to the fact of we did make a mistake and we do apologize.
So Leslie continues to fight for justice and to educate others, knowing this case is not unique.
I was so furious because that should not have happened.
Amble, which markets itself as an easy, low-cost provider of GLP-1s, did not respond to or answer questions we asked related to this case. Beluga Health told us the company could not respond due to work demands. Kevin Kennedy, WFMY News 2.